So does birth control, drinking from a plastic cup, getting breast implants, or even drinking coffee, does any of this increase your risk of getting breast cancer? Let's break it all down once and for all. My name is Ade Tutu, and I am a board certified women's health nurse practitioner. And on this channel, we break down women's health related issues in the way that you and I can understand it. And today we're going to talk about something that it's everywhere, right? Breast cancer. And it seems as if more and more younger women are getting diagnosed with breast cancer. I know it's scary. We're all scared. I'm scared too. And today we're going to break down what we can do to decrease our risk of getting breast cancer. Let's get right into it. Okay, so let's jump straight into it. So the first one is plastics. Do plastics increase your risk of getting breast cancer? And the answer is yes. Plastic supplies contain something called phthalates. It is a chemical that has been linked to breast cancer. And another thing, it is also found in a lot of our beauty products. In toys, in a lot of our perfumes and things like that. But don't you worry, I'm not telling you to throw them all out. A little goes a long way. So what we can do is opt for little changes, right? Do fragrance free sometimes. Sometimes you can do fragrance free. And then choose beauty supplies or supplies that say phthalates free. A lot of these cosmetic companies are aware of the effects of their beauty products, right? So they do give you those options and make you aware. Sephora actually has a section of phthalate free beauty products. That's how much all these beauty companies are aware of it. And then other ways that we can make changes is opt in for glass or porcelain or stainless steel, all right? And if you must choose plastic, pay attention to the back of the plastic where there's a triangle that has a number. Now, if it says 1 or 7, those have more phthalates. Opt for the ones that say 2, 4, or 5. Those usually have less phthalates. So those are the little changes we can do regarding phthalates. Okay, now let's talk about vitamin D. Now, vitamin D is the main vitamin that has been linked to breast cancer. All right, so research shows that women who are diagnosed with breast cancer usually have low levels, lower than 20, and greater than 40 offers protection against breast cancer. Now, I'm not going to tell you to just go to the shelf and grab a supplement. I am big on doing your blood test, knowing your levels before starting supplementation. So get to a provider, a doctor, so that they can check your vitamin D levels. And then based on that, for some, it could just be replacing it, getting some extra sunlight, eating some salmon, eating some eggs, eating some mushrooms, those type of things. But for others, and I'm talking to you, Black women, because it's been known that women of darker skin complexion actually have less vitamin D. So for us, we will need a little bit more. And we definitely need to go get our blood levels checked and see if we need to add some supplementation, as in tablets, to that. So, number 2, vitamin D deficiency has been linked to breast cancer. So, the third one is decreasing your fat levels in your body. So maintaining a healthy weight. I know you're like, oh, here we go with this weight stuff. Okay, but let me tell you why. So excess fat can actually start to make estrogen, and estrogen can feed potential cancerous cells. So in our body, most of us have potential cancer cells. Now, sometimes they just die off and go away, and our body repairs it on its own. But other times, these cancer cells can be fed and grow, and excess fats can cause estrogen to cause it to grow. This is why it is so important to maintain a healthy weight. Research shows that even a weight loss of 20 pounds has been shown to decrease a woman's risk of breast cancer. So staying at a healthy weight actually keeps your body safe and strong. I know. We are on the train of diet right now, but I want to bring your attention to fiber diet. Oh, this is one of my favorite things to talk about. Now, fiber is a game changer when it comes to breast cancer, and I'm going to tell you why. So, fiber does a slew of things. So, first, it decreases blood sugar levels, and cancer loves sugar, right? So, it decreases that. Check. It decreases excess estrogen level, which we talked about increases your risk of breast cancer. Check. It helps you maintain a healthy weight. It helps you feel full longer. It improves digestion. Check. And it also helps to push out cancer-causing substances through digestion, and it decreases chronic inflammation. I can talk so much about fiber. When my patients ask me which diet is best for me, is it keto? Is it paleo? Is it this? Is it that? And I'm like, incorporate a high fiber diet into your life. And I'm not talking fiber from supplements. I'm talking fiber from whole foods. That is one of the best things that you can do for yourself. It not only decreases breast cancer risk, but it improves your health overall. We're going to talk so much about fiber on this channel because fiber is something that is not talked about enough. And we're going to talk a lot about it. Let's move on. Okay, so before we move on, I'm going to show you guys a high-packed fiber breakfast that I love to incorporate into my diet. Now, every 10 grams of fiber you eat, you decrease your risk of having breast cancer by 4% for every one that you eat on a daily basis. That adds up. So here we're going to increase our fiber. So let's get to it. Let me show you this recipe right now. So I start off with oat milk, and that is about 3 dietary fibers. Okay. And then I add my lovely flax seeds. 2 tablespoons equates to 3 grams of fiber. So we're at 6. And then I add my chia seeds. Now, chia seeds, 1 tablespoon equates to 10 grams of fiber. So altogether, this little one thing is 16 grams. So I just wanted to show you guys how easy it is for you to get fiber throughout the day. Now, I do want you to start off slow, especially if you haven't started a high fiber diet. I've been doing this for a while, so I can tolerate this. You will be in that bathroom. That is one of the things about fiber. It gets your digestion flowing, as we talked about, right? So you will be in that bathroom, so you want to start off slow. But the daily recommended dose is 30 grams. Okay, so I wanted to show y'all how easy it is for you to be able to get 30 grams in a day. Now, if your lunch and dinner is fruits and vegetables and whole grains and all the things and legumes, you will definitely get to that 30 grams. Let's go back to the video. Did you know that World Health Organization is actually considering working night shift a probable carcinogen, meaning that it can cause cancer? And working night shifts can actually increase a woman's risk up to 4 times. 4 times. Now, I know a lot of us nurses cannot help working night shifts, right? But there are ways that we can decrease the risk. So first things first, try to decrease the length that you're working night shift, all right? So working more than 10 years has been linked to breast cancer, all right? So hopefully if you can help it, work less than 10 years on night shift. And here are other ways. So it's been found that if you work consecutively, your 2 to 3 days shifts, work it consecutively, all right? And then make sure that you're resting 2 days after. Okay, so 1, 2, 3 night shift, or 1, 2 night shift, and then 1, 2 you rest. Another one is trying to keep the same sleep-in schedule. I know that's difficult. I've been there. I've worked night shifts. It is not easy, but try to make these little small changes, as it can make a big difference in the later run. Okay, so this is a very common question a lot of women have about birth control. And the simple answer is yes. Birth control pills that contains estrogen and progesterone can increase your risk of having breast cancer while taking it. The good news is once you stop taking birth control pills, give 2 to 5 years, that risk decreases. So it's a temporary increase while taking it. This is why you should limit the years that you're taking birth control and consider alternatives such as non-hormonal IUD, using condoms, and fertility awareness method. I made an in-depth video about fertility awareness and how to use it as birth control. So check that out right here. So next is breastfeeding, and how breastfeeding can reduce your breast cancer risk is pretty much it can clean up your breast tissue by getting rid of old or damaged cells. And also breast milk contains a protein called alpha lactalbumin, and pretty much it just fights off cancer cells. So breastfeeding can actually protect you and your beautiful baby. Now, I know that breastfeeding is not an option for everyone, and I also know that it's not easy. But if you're able to and you have the opportunity to, even breastfeeding for a few months can go a long way. Okay, so next is smoking. I know we have all heard enough about smoking. We all know that smoking causes cancer, breast cancer, liver cancer, bladder cancer, lung cancer, uh, uh, li- uh, I ran out of cancers because it causes all of them. So if you have not started, please do not start. And if you do smoke, consider decreasing it or better yet, eliminating it altogether. Smoking not only causes breast cancer, it can cause complications after diagnosis. So let's just put that cigarette down. Okay, next is alcohol. I know. I don't want to take your alcohol away from you, but simply put, the more alcohol someone drinks, the more their chances of having breast cancer. It increases that risk. So having one drink a day is not linked to breast cancer. Having more than that is. So just stick to having a drink a day. Now, there are different variations of that, which I'll show you all right here. And finally, exercise. And not only exercise, but limiting your time sitting. And I know it could be so difficult during this post-COVID era where we've gotten used to just sitting and scrolling and working from home and those type of things. But we know that exercising is one of the best things we can do for us. I can list a lot of things that exercises does. It reduces inflammation. It helps us lose fat, which decreases that extra estrogen. You feel good. So many benefits from exercise. Do me a favor. After this video, get up and walk. There is a trend on TikTok that people call the hot girl walk. You can join that. Or better yet, work out right here with me on my stepper. Let's get to moving together. Ooh. Oh, and one last thing. Breast implants and caffeine were actually not linked to increased risk of breast cancer. So my caffeine girlies, we are smooth sailing. There you have it. Those are all the ways that we can reduce our risk of breast cancer. As always, it is my pleasure educating you. I do hope to see you next time. Like and subscribe for more on women's health. Thank you so very much for watching. You take very good care of yourself.